Hi guys, welcome to another screencast for A2 PE Exercise Physiology. Today we're looking at the health components of physical fitness and in particular aerobic capacity. Okay, some basic definitions first of all. Aerobic capacity is defined as the ability to take in and transport oxygen to sustain prolonged periods of aerobic or sub-maximal work. We also look at Vo2 Max, and Vo2 Max is the highest rate of oxygen consumption attainable during maximal work. And the highest values are normally recorded in aerobically based events such as cross-country skiing. Okay, there are a number of factors that affect Vo2 max, and we're going to look at those just now. The first one is your individual physiological makeup, and this is basically 4 body systems within your body. And the first one is your heart. It's your heart's ability to transport oxygen, which can affect Vo2 max. It's also your muscle cells' ability to use oxygen. It's also your vascular system to transport oxygen. And finally, your respiratory system to consume oxygen. So those 4 body systems can affect an athlete's Vo2 max. The next factor is hereditary and genetics. So you may well be born with a high percentage of type 1 muscle fibers, which kind of determines which sports you may well be successful in. Secondly is training, and in particular specificity of training. So if your training is specific to increase Vo2 max, then of course you're going to get those long-term adaptations in terms of aerobic training that you're looking for. Next one is age. Now Vo2 max can decrease after the age of 25, and it would decrease linearly during that particular time. We are going to look at age in more detail on the next slide. And the last one is gender. Now females tend to have a lower Vo2 max than males, and we're going to look at the reasons why in the next couple of slides. So let's look at age in more detail. So basically your Vo2 max can decrease with age because your cardiovascular system. As you get older, your maximum heart rate, your cardiac output, your stroke volume and your blood circulation will all decrease as you become older. Additionally, your respiratory systems can determine your decrease in Vo2 max with age, because all your lung volumes will decrease as you get older. However, if you continue to aerobically exercise as you become older, you will maintain or even slow down the decline in Vo2 max. That's kind of a huge benefit of making sure we participate in some sort of physical activity as we get older. Let's look at gender in more detail. Here we have Kerry-Anne Payne, who's a long distance swimmer, and here we have Mo Farah, who's obviously a long distance runner. Now the typical values for these 2 athletes are on the screen just now. As you can see, Mo Farah is able to have a higher Vo2 max as opposed to Kerry-Anne Payne, and these are some of the reasons why. Females tend to have a smaller lung volume, which decreases external respiration and your ability to take in oxygen. Females tend to have a smaller heart, which will increase your resting heart rates, lower your stroke volume, and therefore lower your cardiac output at maximal rates at work. And finally, females tend to have lower hemoglobin levels, which decreases your oxygen transport and also your blood flow to the working muscles during maximal work. Guys, that's about it for now. Those are the factors affecting Vo2 max. Please bring those notes to your next lesson.